everyone. So today we will be dealing with another topic, that is calculation of infusion rate of dopamine. So this will study by the help of one case, and the case is like this. A 50-year-old male weighing 60 kg presents to the emergency department with symptoms of shortness of breath and chest pain. His extremities were cold and clammy, and he gave history of decreased urination. He was provisionally diagnosed to be a case of myocardial infarction, and his systolic BP was 80 mm of mercury. Prepare to start the dopamine drip to manage the patient. So first things first, there is a history of decreased urination, which means there is decreased renal perfusion. Okay, there is decreased renal perfusion. And why we give dopamine in this case? Because dopamine is a sympathomimetic, and we know that dopamine in low doses, what it does, it causes vasodilatation of the renal arteries, and thereby there is renal perfusion. In another video we will discuss at what doses the dopamine has got which kind of action, but for now let us concentrate on how to calculate the infusion rate of dopamine. So what are the details that we need, or what are the details that we require? One is drug, that is dopamine. Second is available dosage form, that is ampule of 5 ml, and 1 ml contains 40 microgram of dopamine. Next is dose at which dopamine is administered. So the dose is 5 microgram per kg per minute. What is the route of administration? It is IV route. What is the diluent used? It is normal saline. And what we have to calculate? The rate of administration. So let us see once again. So the drug is dopamine, and it is available in the ampule of 5 ml, and each ml contains 40 micrograms. And the dose at which dopamine is to be administered for cardiogenic shock, or in cases where there is decreased renal perfusion, is 5 microgram per kg per minute. So in this case we will take the dose is 5 microgram per kg per minute. What is the route of administration? It is intravenous route, and the diluent used is NS, or normal saline. So how will you calculate? So 1 ampule of dopamine will contain 5 ml, and each ml will contain 40 microgram. So total 1 ampule will contain 200 microgram, and each normal saline bottle contains 500 ml. So let's say we mix 1 ampule of dopamine with 1 pint NS, or 500 ml NS. Okay, so we know that weight of the patient. What is the weight that is given? The weight of the patient is 60 kg. So the weight of the patient is 60 kg. Dose required is 5 microgram per kg per minute. So total drug that has to be administered in 1 minute will be equal to 60 into 5, that is equal to 300 microgram per minute. 1 ampule of dopamine is put in 1 bottle of NS. So 200 into 10 to the power 3 microgram is mixed in 500 ml NS. So 300 microgram is contained in how much ml NS? How will we find out? 500 divided by 200 into 10 to the power 3 into 300. Okay, so this comes 15 by 20 ml of NS, mixed dopamine. So 15 by 20 ml is to be infused in 1 minute, and we know that 1 ml is equal to 60 microdrops. So 15 by 20 ml will be equal to 60 into 15 by 20, that is equal to 45 microdrops per minute has to be infused. So this is the answer. Okay, pure unitary method of calculation. First you need to calculate the dose required, that is 5 microgram per kg per minute into 60 kg, that is 300 microgram per minute. Next thing we have to remember, 1 ampule is mixed in 1 bottle of NS, that is 200 milligram is mixed in 500 ml of NS. So that we will convert 200 milligram to how much microgram? We'll multiply 10 to the power 3 there. So 200 into 10 to the power 3 microgram is mixed in 500 ml NS. So 300 microgram is required per minute. So 300 microgram is contained in how much ml NS? So that is 15 by 20 ml. And this has to be infused in 1 minute. So 1 ml contains 60 microdrops. So 15 by 20 ml will contain how many microdrops? That is the infusion rate. That's all. Thank you.